Okay, so this is Husky, and if you can think of a better name, by all means, we are open. But Bowie is already taken. Um, so I use these life-size models because I don't know if you can see, but I've got these like little stickies all over them. And that was when I was learning acupressure points. And blue is for the kidney and the bladder meridian. Um, and then it also, the bladder meridian has like a lot of what's called like alarm points that indicate if there's like more serious problems underlying, like organ problems underlying. And just FYI, if there's a problem, usually you'll go to like one of the bladder points first. If it feels like squishy or hard or cold or too hot compared to the surrounding tissue, then you've got another backup, and that's a secondary alarm point. That's usually more for acute conditions. So like the bladder meridian serves two functions. One, it will help with actual conditions, as well as there are certain points on there that serve to tell if there is something much deeper, visceral, like organ related going on. I hope you can see me. Well, you don't need to see me. I look horrible, but Husky, beautiful Husky is here. Anyways, the lung, the lung meridian is supposed to be right here. So let's put it back there. Okay, so this is the other thing I wanted to show you that's so cool. So I got it at Moonlight Cafe on Hastings. And there's different versions, but I find all the other versions out there way too easy for my heavy chewing dogs. This one, on the other hand, as you can see, has like so many different holes. And Bowie in particular, he cares less about the treats. And I've stuck a little squeaky in there. He's probably killed it by now. But yeah, I buy like a 25 pack of like little what do you call it, squeaky things, and then I'll resurrect his toys. I'll wash them and then like superimpose the squeakies by putting like KT tape and other cushioning around it so that the teeth can't kill the squeaky as easily. But anyways, like they'll go at it for like forever, especially if they're hungry and I'm not freely giving them alternatives. If I freely give them an alternative, they'll give up on this and be like, yeah, see ya. But if I'm like, no, you gotta like get the last treat out of there, they'll sit there for like an hour and a half. No joke. And these are dogs that are like obviously quite spoiled because I make treats. And so I always have tons of treats around the place. Okay, so let's get to the point. If you have a dryer in your place, I still do not have a dryer in my place, because remember I spent all of my money on going back to school and taking almost 3 years off. But so I am renting. But if you have a dryer, great. You can just like spray a little moisture on it, or like lightly moisten it, and then this is small. You might want a bigger one for Leo, like a proper uh, like this is a face cloth. You might want a hand towel. And then what I would do is, like, once it's nice and warm, not too hot but warm, because you don't want to burn the area, but just to warm the area, like, so, like, say at night you guys are like watching Netflix, or you're about to go for a walk. Like, I recommend, especially in the winter time, using this towel trick all the time in the winter, because it helps warm stiff joints. And so, like, if the problem, lipoma or whatever it is down here, then you don't necessarily want to put it right on it, but you want to, like, warm the area around it, because remember, the bigger that is, it's like tugging and pulling on the fascia around it. And there's remember the analogy that I think I mentioned at the beginning, or the comparison between fascia and muscle? Fascia is like a spider web, and if you tug on one corner of the spider web, the entire spider web, like, either falls apart, or the analogy there is that all of the fascia is connected. So fascia wraps around every single muscle fiber. It wraps around all of the organs, but it also creates kind of like a bodysuit. And fascia is so critical, because it has, like, electrical highways that travel through it, nerves travel through it. It's fascinating on a million different levels. But you can also have fascial restrictions, and fascial restrictions could be happening here for Leo, where it's just repetitive micro tears every single day. And what you would see if you were to cut it open, which you are not going to do, but like, I do it all the time, because I make those lamb wafers, and I see lambs that are, like, you know, totally healthy, no fascial restrictions. And then I see lambs that have major fascial restrictions, possibly from an injury when they were young, and then chronic micro tears. And I can actually send you a picture of what a fascial restriction looks like. It looks like 10 or 15 different spider webs trapped on top of each other. And what it does is it essentially creates stiffness and affects the muscle, and it's not pleasant. But the other cool thing about fascia is that it's like shea butter or something, or coconut butter. It warms really quickly to the touch. So if you can do the same thing by, like, if Leo is calm and doesn't wiggle around, you can, like, hold Leo there and just warm the area with your hand, you know, for maybe 60 to 90 seconds, depending on how cold it is in the room. If he's lying in the sun, obviously you don't have to do anything. um, but yeah, a good way in between is to take a nice, moist, warm, or hot towel. Make sure it's not too hot, and then just not directly on the lipoma or undiagnosed mass, but um, around it. And so you're softening the fascia around it. Then, step two, you're going to do an effleurage. So an effleurage is essentially a flat palm. It's different than petting. Petting is like this. I'm petting my dog, and I can do it slowly. I can do it, you know, this is petting a dog. It feels great, but it's not the same as effleurage. Effleurage has intention to it, and it's a flat palm, and you're going either slow or fast. If you go fast, you're obviously trying to match the energy or pick up the energy of the dog. If you're wanting to calm the dog down, then go slower. And so just where you've added some extra warmth to the area, and say Leo is lying on his side, so this is along his external obliques, and this whole area is his lats. Imagine like a big triangle. And so right where that's located, it's located like in a critical area where the triceps are, the latissimus dorsi, which connects all the way up here like a big triangle. It's also connected to the deep pectorals, which is a nice stabilizing muscle. It's in an area that's significant. So use effleurage with a soft hand. The best way, count to 20. So nice flat palm. You can count to 20, and then move to another area and count to 20 again. So that's your basic Swedish stroke. I've heard of very successful massage therapists, and this is all they do, effleurage. Because A, that's all the dog will tolerate, and B, that's all the dog might need to work out some of the kinks. More often than not, though, effleurage is going to do nothing for circulation. Really, it's not going to do anything for trigger points, for tender points. It's not going to do anything for manual lymphatic drainage, because you're reaching more the cutaneous, the top level. So yeah, anyways, that's effleurage. So warm the area, and if you're outside and it's a sunny day and he's already sitting in the sun, then probably the area is warm enough, and just use effleurage and relax the area or relax the fascia around that area. So I'm gonna put him on a lateral supine. I'm gonna put Husky on his side, and just to show you. So here we have like the cranial. This is the cranial pecs. These are the deep pecs right between. And from my understanding is that lipoma is like right here. And so it's pulling on those deep pectorals, but it's also pulling on a myriad of other muscles. And so I don't care what vet, if you have a vet that says, oh, it's probably not bothering him, they're lying. They're lying. They're absolutely lying because um, you try having something that size on your body and doesn't bother you. Dogs are masters at hiding pain. Just remember that. So, the fact that he's showing you, like dogs will show you through actions because they can't really talk to you the same way that we can talk to each other. But he's showing you through actions that he's starting to feel a little bit more flexible and mobile, and that's amazing. So let's ride that wave. Let's continue. Um, I think that's about it for now, unless you have a name for a husky. I think, yeah, feel free to ask me any questions, and we'll go from there. Okay. Bye, Juliana.